You've done it. You made it through the first three parts, you drained your coffee pot, and now you've made it to part 4, which we're going to talk about a little bit about methadone prescribing. Generally, a physician may prescribe methadone or any other narcotic for a patient for analgesic or pain purposes only. A narcotic-dependent patient who is to be or is being maintained or detoxified cannot receive a narcotic prescription order for this purpose. That being said, narcotic prescriptions are only valid for treating pain. And a lot of companies out there, or I know retail pharmacies, are requiring their pharmacists to, when they receive a controlled substance Schedule II prescription for methadone, they are ensuring that it does have a diagnosis on there. And because it's not a part of the name, or date that you can't change, if that diagnosis for methadone is not included on the prescription, a lot of the pharmacists will call, verify with the doctor what his indication is, and then write that diagnosis on that prescription with the initialing of date and who they spoke with. The administering and dispensing, but not prescribing, of narcotic drugs listed in any schedule to a narcotic-dependent person for detoxification or maintenance treatment are only permissible by a narcotic treatment program registered with the DEA, the FDA, and licensed in Texas by the Texas Commission on Alcohol and Drug Abuse. Also note that these programs also must possess a permit issued by the Texas Department of Health. Only 4 individuals employed by the narcotic treatment program can dispense or administer narcotics to patients. First being a licensed physician, second being a registered nurse under the direct supervision of the licensed physician, third being a licensed practical nurse under the direct supervision of the licensed physician, and fourth, a pharmacist under the direct supervision of a licensed physician. A physician who is not part of a narcotic treatment program may administer no more than a 3-day period to relieve that individual's acute withdrawal symptoms while the physician makes arrangements to enroll that patient or individual in a narcotic treatment program. A hospital that has no narcotic treatment program on premises or a physician who is not a part of a treatment program may administer narcotics to a drug-dependent individual for either detoxification or for maintenance purposes if that individual is being treated in the hospital for a condition other than addiction. This is a good example for when a patient like this is admitted in the hospital for surgery, then they can be administered methadone or other narcotics for their detoxification or maintenance therapy. Office-based opioid dependence treatment is an option that's available today, but takes a little bit of work on the practitioner side. The Drug Addiction Treatment Act of 2000, or DATA 2000, allows specially trained practitioners to prescribe certain narcotic Schedule 3 through 5 drugs to treat opioid dependence through a risk management program, which includes a close monitoring of drug distribution channels. A practitioner authorized to prescribe under this act, sometimes called a data waived practitioner, is given a DATA 2000 identification or an X code, sometimes called an XDEA number. This must be included with the practitioner or prescriber's original DEA number. If you remember earlier, we talked about Dr. Boyd. His DEA number was AB1234563. If he was given an X code or an XDEA number, that number would be XB1234563. So the first letter would be replaced with an X. If a pharmacist wants to confirm or can confirm a practitioner's waiver status, they can do so on the Substance Abuse and Mental Health Services Administration website or the SAMHSA website. I hope you still have that worksheet out. A couple more things to go. Drugs that may be dispensed under this program are Subutex, which is the brand name for buprenorphine, and Suboxone, which is the brand name for buprenorphine naloxone combination. These drugs, both Schedule III controlled substances, are available in sublingual form and may be dispensed by a pharmacy upon a prescription from a qualified practitioner. A data waive physician may be allowed to treat up to 30, 100, or 275 patients depending on his or her authorization. Physicians can submit a notification for the need to increase patient limit after treating their previous patient limit for at least 1 year. In 2016, the Comprehensive Addiction and Recovery Act expanded privileges to advanced practice registered nurses and physician assistants. APRNs and PAs must complete 24 hours of training to attain a DATA 2000 waiver and can initially treat up to 30 patients. After 1 year, a data waived APRN or PA may apply for authorization to treat up to 100 patients. One thing to note is that to be a data waived APRN or PA, their supervising physician must also be a data waived or a DATA 2000 waived practitioner. Well, I'm super proud of you. You made it, and I know what you're thinking. Good grief, Dr. Ashley, that's a lot of content, and you're exactly right. So take your time, go back through what you need to, pause, rewind, fast forward, whatever, but make sure you get that worksheet complete. Turn that thing in by Sunday, April 19th at 11:59 p.m. You can work on it individually, you can work on it with your teams, whatever you want to do. Teamwork makes the dream work, but I want each of you to turn that assignment in individually through the assignments portion on Canvas. Upload that thing, it will be graded, and it will be a quiz grade for you. Then take it, study it, use that for your final exam for my content. And lastly, hang in there. I know it's almost at the end of the semester, and I know that you guys have been through a lot, but know that we're proud of you and we're thankful for you, and keep on keeping on. If you have any questions about any of the content, please email me with any of those questions at jeremyashley@uttyler.edu. Thank you guys.